Now back to IRG's Health Talk.
All right, our next guest is no stranger. He's been here before, Dr. Bryan Holand, a foot and ankle surgeon. He specializes in reconstructive foot and ankle surgery, complex deformity correction, and sports injury. And he's talking about the recent injury in the NFL to Carson Wentz of the Eagles. Here he is with Shannon O'Kelly.
Dr. Bryan Holand, welcome back. How are you?
I'm doing great, buddy. Thanks for having me.
Thank you for coming back. Hey, this is great. Last time you came on, we talked about kind of that old nemesis, plantar fasciitis. And, you did a great job. You explained it really well. It's a difficult situation, but you're board certified in and trained in foot and ankle surgery. And a couple days ago, I was watching the NFL, the opening season of the NFL. I'm pretty excited about that. We've got fans in the stadium. It kind of feels normal again. But I watched the Seahawks play the Indianapolis Colts, and the starting quarterback for the Colts is Carson Wentz. Carson had some surgery early on in the season. I think during the offseason, he had some kind of foot surgery. They anticipated him out 6 to 12 weeks. He returned, I believe, at 5. To me, he looked great, very mobile. I couldn't even tell he had any kind of surgery. I researched a little bit. I wanted to chat with you. What I know is some kind of an injury that maybe resurfaced from a situation or an injury he had in high school. So there's probably a couple different options, but let's talk about that. Let's talk about what could be going on here with Carson Wentz and what he had, maybe a little speculation on our part, but I'm excited to talk to you again. So what do you think's going on there?
Yeah, so let's backtrack a little bit about kind of the anatomy of the foot that he injured. If you feel along the outside of your foot, the hard bump you feel before the side of your heel is called the tuberosity of the fifth metatarsal. You have a muscle that originates on the side of your leg called the peroneus brevis that attaches to that spot. When that muscle fires, you evert your foot. 85% of ankle sprains are inversion injuries. So as an everter of the foot, the peroneus brevis plays a big role in stabilizing the foot. So going back to the tuberosity of the fifth, that area has 3 different zones, each pertaining to a type of fracture. Back in high school, Wentz had what we call a type 1 avulsion fracture of the tuberosity of the fifth metatarsal. He rolled his ankle inward and his peroneus brevis fired during that process, trying to stabilize his foot, and most likely pulling a piece of the bone in the process. This injury is quite common. The injury likely healed and scarred in since his high school days, and it sounds like he might have re-aggravated it during training camp.
Oh, good stuff. Okay, let's talk about that. Let's dig down. Fantastic job. So here we go. We have an inversion, or we have a typical rolling of an ankle in high school that peroneus brevis tries to stabilize it. It fires really hard and basically pulls that little chunk of that fifth metatarsal off, separates it. It's an avulsion fracture. It scars over, it heals. All of a sudden, this last preseason, during training camp, he's moving around. I understand he felt a little bit of a pull or kind of a twinge, and he re-aggravated, and he tore that muscle off. I mean, he tore that avulsion fracture tore away, most likely.
That's correct, Shannon. Yeah. For an avulsion injury like that, put the patient in like a walking boot. We want to prevent the muscle from pulling on the bone, and because too much motion is the enemy of bone healing. Most patients are pain-free 2 to 3 weeks and can start functional rehab process after that. I'd say around 95% of patients go on to heal from this injury without complications. In the 5% that don't heal, someone like you can do a bone re-stim to help them heal.
Yeah. That's interesting. Real quick, I want to ask you something. So, I'm just speculating these athletes in high school that have a fairly significant grade 2, grade 3 inversion sprain. This is when they tear the ligaments on the outside of their ankle or the lateral side. You're saying maybe 5% of them, sometimes maybe, I'm just trying to pick this up, might have this typical or this fifth metatarsal tubercle irritation avulsion?
Yeah. A common complaint for this type of injury is ankle pain. The anatomy and anatomically speaking, they're kind of right next to each other. So absolutely.
Can you, as a physician or practitioner, we should be able to probably, if that's going on, normally we can palpate right distal to what we call the fibular head and really identify those ligaments. But if I go down to that fifth metatarsal, that knuckle on the outside, as you described, that it should be painful to palpation right there if that thing is avulsed, right?
Absolutely. Yep.
Can you pick this avulsion up when you do an x-ray, or is it so minimal, so small that you need a very specific diagnosis?
Yeah, you could, if it's avulsed, you'll see it clearly on an x-ray. It's important to not confuse it with a Jones fracture, which is a much more serious injury like what Kevin Durant had. That area is poorly vascularized. So a lot of times a Jones fracture might not heal well, or if at all, whereas an avulsion fracture like this can and will heal.
Back with more with Dr. Holand and Shannon O'Kelly next on Como.
It's a Northwest lifestyle weekend on Como News. IRG's Health Talk continues.
We continue our chat with Dr. Bryan Holand and Shannon O'Kelly now.
Dr. Bryan Holand, again, thank you for joining us. We're talking about Carson Wentz, talk about potential injury he had back in high school. Come to find out, he may have had an avulsion of his fifth metatarsal on the outside. Okay, we diagnose this thing. We find out what it is. We diagnose it. We got to take that avulsion, that fracture. Don't we have to take that out? How do you do that?
Yeah, well, if it becomes a recurrent, injury, or in this case of Carson, where he reaggravates it, you can, remove the bone. So in this case, you do surgery where you detach the peroneus brevis from its insertion, you remove the piece of bone, and then you reattach the tendon to fifth metatarsal using bone or suture anchors. And at this point, the healing becomes more of a tendon and soft tissue healing issue than a bone issue. And in general, soft tissue heals quicker than bone.
And that's the biology. That's the biology there, soft tissue. So, I mean, you're taking that out, retaching that tendon back on that bone, suturing down or using some kind of anchors. That takes about 6 to 12 weeks just healing, right?
Right. Wentz was estimated to take 5 to 12 weeks to recover. And the range in the recovery period, I believe, varies from athlete to athlete. A dual threat quarterback like Lamar Jackson or running back who relies on a lot of lateral movement and cutting will likely take closer to 12 weeks than 5 weeks. And judging by yesterday's game, Wentz is mostly a pocket passer. I believe he only rushed 4 times. So his recovery time was going to be shorter. And with all that said, Wentz definitely had a rapid and faster than usual recovery time.
Yeah. Let's talk about the other option. There's one other option there where that, what is that, os periosteum, or I'm drawing a blank, but you know what it is. Tell us about that, potentially that bone there. Yeah,
so there's an accessory ossicle or an accessory bone in the foot called the os peroneum. It's right near there, and of course is in the tendon sheath. And his teammate, actually Quentin Nelson, had an os peroneum that was removed, like a day after Wentz got his injury. So it's very rare, to have these two conditions, like much less two teammates kind of have these two problems and, have the same surgery.
And so what's going on there in that bone that's in that tendon? It's in the peroneus longus tendon, and it acts as a fulcrum. How does it become inflamed, irritated, and why does it have to be removed as we wrap up our recording here?
Right. Accessory ossicles like the sesamoids in your foot or the patella in your knee, they kind of act as kind of like a fulcrum to help the gliding motion of the tendons. And, often, they can become inflamed, and when they become inflamed, they can cause pain. So if they cause pain, it's a viable treatment option to just remove it.
Okay, just take it out, and that's you're not really. But then if you're just removing it, you're not suturing anything or repairing anything. So it's just a little bit of healing. It's not the 6 to 12 weeks then, just when you take it out. Meaning if you don't do any soft tissue repair, the recovery's faster.
That's exactly it, Shannon.
Okay, great. Well, that's excellent information. Dr. Holand, thank you so much for your time. We'll have to keep an eye on these foot injuries as we progress through the season. It's always great to get an immediate update. I thought Carson looked pretty good, though. I thought the Seahawks looked wonderful. So I think we're going to have a good year, okay?
You guys look great yesterday, and I'm definitely nervous about my Niners playing you guys.
Okay. All right. Take care, Dr. Holand. Thank you for your time.
Always a pleasure, Shannon. Thank you.
All right. We've been listening to Dr. Bryan Holand, millcreekfootandankle.com. If you'd like more info. Shannon, there's been a lot of injuries already this year, and a lot of them are, despite all the medical advances, it happens.
Well, just can you imagine, Tom? Your hands, have you ever, hit your thumb or, hit it with a hammer or it just interferes with everything you do functionally. Think about the feet. We stand on them, we roll over on them, we weight bear on them, and when you have a foot and ankle problem, it's significant. It is, if anybody's ever had one, obviously you've gone through a lot of stuff with your lower extremities. It changes your life when you have foot or ankle problems.
All right, thanks again to Dr. Holand. We'll be back with our final segment after this time out on Como.